Well, getting sick is never fun, especially around this time of year. In normal years, it's hard to tell the difference between a cold and the flu.
And you add that to the mix, add COVID to the mix, and that adds to the concern. Our Desmond Matthews talks to local healthcare professionals about getting the right diagnosis. Desmond?
Covering your mouth when you cough or sneeze is a simple way to prevent spreading germs. Wearing a mask also helps, according to medical professionals, but determining whether someone has COVID-19 or the flu can be tricky.
It's that time of the year in Mississippi where the weather will play tricks on you, which can lead to sneezing, coughing, fatigue, and even body aches. COVID-19 is now in the conversation when people start having cold or flu-like symptoms, and it's difficult to tell the difference because the symptoms of each of the viruses are so similar, but the effects are very different.
People stay contagious for longer with COVID than they do the flu. So typically with flu, you might be contagious for about a week after getting it. But with COVID, that lasts up to 10 days to even 2 weeks after.
Dr. William Rosenblatt, an internal medicine physician at Baptist Memorial Golden Triangle, says the only way to be sure is to get tested.
We do have rapid PCR tests that test for both flu and COVID, both strains of flu plus the COVID-19 strain. And those turn around in about 20 minutes. So it's a nice way to tell which one, if either, that you have. And that's important because the treatment for each differs widely.
Over at Allegro Family Clinic, pharmacist manager Hank Norwood and clinic president Amy Bowles say they also offer tests for COVID-19 and the flu.
You can have one or the other or both. So oftentimes at this season, our providers will test you for COVID and flu at the same time because we want to know which one it is. And you can have them both. We've had pediatrics and adults diagnosed with both.
Controversy over the COVID vaccine is now having an effect on flu shot numbers.
As a system between the clinics and the pharmacies, we're giving far less flu vaccines. So for us as providers, we're really intrigued and interested to see how this flu season is going to hold, and a little nervous because we don't want to flood our systems, I guess, with so much.
Once the results are in, if the diagnosis is COVID, quarantine is the first step of treatment. But over-the-counter medicines can help relieve symptoms of each of the viruses.
Over-the-counter cough and cold, we do the cough syrups. The Robitussin are very good. The Delsum cough syrup. We do the antihistamines, the Zyrtex, the Claritin, used for the drainage. Flu part, of course, you're always going to have body aches, so we'll do the Tylenol or the ibuprofen for that. But also the Oscillococcinum, which is a natural remedy we also use to treat the flu virus.
Now, if you or someone you know are having flu or COVID-like symptoms, you're encouraged to get tested for both viruses to be on the safe side.